Today is National Physician Suicide Awareness Day. Doctors have the highest suicide rate of any profession, and sometimes they're unable to discuss their own feelings of burnout or thoughts of suicide. The COVID-19 pandemic is only adding to the burden. Dr. Cory Feitz is president of the Physicians Foundation, and he's joining us with Cory Feitz, whose sister-in-law, the late Dr. Lorna Breen, died by suicide at the age of 49 this year. Gentlemen, thank you both for being with us this morning. Cory, I want to start with you. I'm so very sorry for your family's loss. Dr. Breen was an ER doctor who died during the pandemic, and the first thing I'm wondering is, was COVID-19 a factor?
Thank you for having us this morning, and that's an excellent question. Lorna contracted COVID-19 weeks before she died by suicide on April 26th. And to be honest with you, we assume that it has been a factor in her death, but we don't know. As you know, this is such an evolving and rapidly evolving piece of just information about how this disease is affecting people. First, we thought it was just affecting taste and smell and the pulmonary functions. Now we know more and more that it's affecting the brain function. I don't think we'll ever absolutely know the answer to that question. But my wife, Jennifer, and I are really working hard to try to find out those answers to prevent future tragedies like we've had in our family.
It's really brave of you to get involved like that. Dr. Price, I want to ask you, why was burnout such an issue with physicians even before the pandemic, and how much worse is it now?
Well, that, of course, is also an important question, Sheila, and thank you for having us on this morning. Levels of burnout among physicians prior to the pandemic had already reached unprecedented levels. Prior to the pandemic, 40% of physicians reported symptoms of burnout. We're releasing a survey today that reveals that number is now up to 58% during the pandemic. There are a number of factors that cause that burnout. Among them are unsustainable long work hours, increasing regulatory burdens, frustration with having decisions about patient care taken out of the physician and patient's hands, and sometimes even a lack of resources to adequately care for our patients.
So I only have about a minute left, gentlemen. I want to ask this question. What can we do for the medical providers in our families to recognize warning signs and get them help?
Sheila, the Physicians Foundation has launched a program called Vital Signs. And you can learn more about that at physiciansvitalsigns.org. But we have an easy acronym to remember, HEART, H-E-A-R-T. And we give patients, physicians, their colleagues and friends tools to not only recognize the symptoms of burnout, but start the conversation that's required to begin the healing process.
So give me that website one more time, because I think whether it's a doctor or a nurse or anybody in the medical profession right now, it's really, really important. So I want our viewers to hear that one more time. Yes, it's physiciansvitalsigns.org. Gentlemen, thank you so much. Dr. Price and Cory, I really want to thank you for sharing your time and your efforts with us today.